Endocrine gland introduction. The endobalance system utilizes surveys, in-office measurements, physical capacity assessments, and lab tests to calculate the impact of aggregate stress on the pituitary, adrenal, thyroid, gonads, liver, blood sugar handling system, digestive system, and immune system. The importance of pulling together all of this information in a survey is to understand the stage that an individual is in. From that, then we can make precise recommendations based on their current health findings and create a specific change for them. Hypothalamus. This is where it all begins. It's considered the master gland of the endocrine system. What its job is to mediate and look at all the stressors going on downstream, takes that information in, and then talks to the pituitary, and then downstream we go. So let's look at the hypothalamus. Sometimes talked about the 4 F's: fighting, fleeing, feeding, and, well, mating. There are 64 known chambers. They direct and govern the entire autonomic nervous system, the main switching station between sympathetic and parasympathetic function. Remember, we already talked about that. It's okay to be in the sympathetic response or parasympathetic. We just shouldn't be dominant in one or the other. The hypothalamus controls all metabolic functions: hunger, body temperature, blood pressure, heart rate, emotions, digestive process, sexual function, and etc. And how does it do that? It does that by what it communicates downstream. Hypothalamus stressors. The hypothalamus reacts strongly to steroids and glucocorticoids. These are the hormones that are produced in a stress response. It also responds to glucose concentrations, feelings of hunger, a drop in temperature, thermosensitivity, leptin and ghrelin, the hormones that make us feel satisfied and full. MSH controls production of melatonin and endorphins, but also can react to the toxins, pesticides, high fructose corn syrup, MSG, aspartame, cytokines. All of these are considered neurotoxins, and anything that is a neurotoxin is going to adversely affect the hypothalamus. Next, we have the pituitary. Remember, the hypothalamus talks to the pituitary. Now, the pituitary produces hormones that maintain homeostasis, including stress management, growth, reproduction, and lactation. Just go back a second. Hypothalamus has a releasing hormone to the pituitary, then the pituitary sends out a stimulating hormone to the appropriate gland. Now, let's investigate some common symptoms when there's an issue with the pituitary. Insufficient or excessive skeletal or muscular development, compromised metabolism, blurred or double vision, insufficient or excessive tissue growth, compromised testosterone, menstrual cycle dysregulation, and breast milk production. All of these symptoms are a sign of the pituitary regulation getting more and more off track. Adrenal. The adrenal glands are considered the stress-handling glands in the body. Primarily, the main hormone that they produce is cortisol, and cortisol can have both an anabolic or a catabolic effect in response to stress. It also produces aldosterone, which can regulate our blood pressure. It also produces DHEA, and to a lesser degree, it produces androstenedione, testosterone, all the estrogens, and 40 other intermediary hormones. It's an incredibly important part of our endocrine system and its role when it comes to stress management. We can look at some of the common symptoms when this gland is starting to get stressed out. We can have compromised energy production, compromised sleep due to too low of cortisol at night or too high of cortisol at night, ligament laxity, an overproduction of hormones, chronic inflammation, compromised immune function, and anxious or nervous, and other mood issues that can tie into what goes on with these adrenal glands. Thyroid. The thyroid gland regulates protein and energy metabolism and plays a large role in neurological development as well as hormone production. Common symptoms that we might see when the thyroid is becoming more out of balance would be muscle loss, poor energy, poor protein metabolism. This could show up with excessive breakdown when the body is in this greater catabolic state, as if we're digesting our own lean muscle. Elevated or depressed basal body temperature, because now it ties back into that regulation of our metabolism as well as our temperature. Hair loss. Common symptom could be the loss of the outer third of the eyebrow. Iodine deficiency. This has a huge impact on the thyroid, considering that the thyroid gland is the largest storage site for iodine in the body. Also, what you might not realize, if you have an issue with the thyroid, it might show up as elevated cholesterol because it also has a role in cholesterol synthesis. Female gonads. The ovaries produce reproductive and stress-regulating hormones. Their primary hormone production is estrogen and progesterone as well. But to a lesser degree, those hormones can then convert into androstenedione as well as testosterone. Let's investigate common symptoms when there are problems within the female gonadal system. We can have an irregular menstrual cycle, cyclic mood changes, sometimes also called PMS, cyclic pain, hot flashes, most commonly seen with menopausal women, but could also be seen in women who are still cycling. Weight gain along hips and lower abdomen, commonplace for excess estrogen to cause women to put on weight. Infertility, the more this system gets out of balance, the more it can interfere with its purpose in the first place, which is fertility. Also, when we have an imbalance between those major hormone players, it can decrease bone mass, which is critical for our older women as they transition into menopause with the increased risk of osteoporosis. Male gonads. The testes produce reproductive and stress-regulating hormones. The primary hormone produced by the male gonads is testosterone. But we have to understand that when this system gets out of balance, it's not just testosterone. This testosterone shares receptor sites for androstenedione, DHT, estrogen, and can convert into those different hormones as well, thus affecting the stress-regulating hormones. Let's look at some common symptoms here. Infertility, decreasing stamina, energy production is compromised, less muscle mass, harder to put on more lean muscle as well as just the loss of it, can experience hair loss. Sometimes it can get to the point of what we call male pattern baldness, and this happens when there's an overproduction downstream to DHT, and also decreasing bone mass. Because as we look at this endocrine system, it's all the hormones in the steroid hormone family affect our bone mass and our bone density. Upper gastrointestinal tract. The upper gastrointestinal tract includes the parotid, esophagus, stomach, and duodenum. These glands are important for immunity and digestion. The parotid gland produces alpha amylase to metabolize starch, and the stomach produces hydrochloric acid to metabolize protein, to just put it in very simple terms. But what we want to understand is that it all starts here. So we want to look at some common symptoms and medications that are used when this system starts to go off track. We can have incomplete mastication, issues with chewing, antacid or laxative use when this system is not functioning properly, compromised starch and protein metabolism, allergies, both environmental and dietary, compromised stool formation and elimination. This could result in IBS-like symptoms where we have diarrhea alternating with constipation. Lower gastrointestinal tract. The lower gastrointestinal tract includes the small and large intestine where vitamin and mineral uptake occur. Neurotransmitter production starts in the mucous membrane from amino acids that have been metabolized from protein. It also produces the enzyme lactase, which breaks down lactose and dairy products. We want to understand here there is also this connection that comes back to the brain. We all know how important neurotransmitters are, and without a healthy lower GI tract, our neurotransmitter production is compromised. When we're looking at the common symptoms and medications, we've talked about we can have increased gas and bloating, compromised carbohydrate metabolism. This is the sugars or fibers. Now remember, if our carbohydrate or sugar metabolism is compromised, this in turn is going to affect the pancreas and could be an early sign of leading to insulin resistance and type 2 diabetes. The increased allergies, environmental and dietary, could increase someone's reliance on allergy meds. Compromised stool formation and elimination. We talked about it in the upper GI tract, but as it continues and it gets worse, this can lead into what is known as a leaky gut syndrome. And with that, we got to go back to the importance of digesting and absorbing our vitamins and minerals here. If we have a leaky gut that's inflamed and irritated, that very basic process that needs to happen in the large intestines is now compromised, which leads into more deficiencies that's going to lead into more dysregulation in this whole endocrine system. Pancreas. The pancreas is divided into two major components. One section produces digestive enzymes for fat, protein, and carbohydrate metabolism. The other section produces hormones that regulate glucose metabolism, growth, and fat metabolism. We want to investigate some common symptoms here as well. When the system is not working properly, we have increased sugar cravings because there's that inability to regulate sugar effectively. Compromised carbohydrate metabolism, which then also ties back into the sugar cravings, which leads us into energy production that's compromised. Remember, mood and energy follow blood sugar. Frequent urination. Again, this ties into the sugar metabolism. Sleepiness after eating, skin discoloration such as dark patches. You see how tightly controlled a system is once again and how symptoms interact with each other throughout. Liver. The liver is the main hormone and toxin detoxifier. It activates blood sugar hormones and produces bile that metabolizes fat. It is important in thyroid and pancreas hormone conversion. It is one of the most important organs in the body when it comes to regulating our hormones, getting rid of excess, as well as making hormone conversion. Now let's look at the common symptoms associated with the liver. We can have poor skin health, the liver spots that we've all heard about, but even trouble clearing out excess toxins, which could tie into increased acne, even in adults. Sclera color changes, bloodshot or yellowing of the eye, poor vascular integrity, easy bruising, constipation, digestive distress after fat consumption. This happens when that bile gets more stagnant and it's not moving as effectively. We can have poor sugar handling, hormone metabolite excess, the inability again to clear out those excess hormones. A physical symptom could be a pot belly that's accompanied with thin arms and legs. The immune system ties the whole endocrine system together. It's comprised of the thymus, spleen, lungs, skin, adrenals, gastrointestinal tract, skeletal system, lymph system. We primarily look at viral, multiple body systems, and bacterial, single body system infections. Common symptoms: ear, nose, and throat infections, lung infections, eye infections, seasonal allergies, skin conditions, lethargy. All of this could be a common symptom of the immune system becoming more and more compromised. We have to keep in mind that this immune system is tightly and intimately connected to the whole endocrine system, and chronic stress, prolonged stress, will suppress the immune system. To summarize, what we want to keep in mind is this is a system that functions and dysfunctions together. It is not a gland that works solely on its own. We don't have just a thyroid issue. We don't have just a pancreas issue or just some GI distress. Everything is interrelated and everything is interconnected. When you have a system that's out of balance due to chronic and prolonged stress, the entire system is affected. To what degree remains uncertain until we do the investigative work, until you do the proper testing, until you do the proper analysis. Only then will you truly understand how this whole system has lost its function and to what degree.
This concludes Session 9, where we went through the stress response and correlating endocrine glands. Next, we're going to take it a step further and present the relationships between the glands. Understanding glandular relationships helps determine the correct supplement and herbal selection.